Hello and welcome everyone to National Government Services YouTube video today on submitting Part B Medicare secondary payer claims with correct insurance type codes. We are National Government Services and we are the Medicare administrative contractor responsible for processing claims in accordance to the federal government rules and regulations. With that said, we are responsible for processing and servicing the providers that fall under Jurisdiction 6, which consists of Illinois, Minnesota, Wisconsin, and Jurisdiction K, which consists of providers in Connecticut, Massachusetts, Maine, New Hampshire, New York, Rhode Island, and Vermont. Thank you for being with us. My name is Carlene Parker, and I am a consultant in provider outreach and education at National Government Services. I hope you find this YouTube informative and helpful. Our session objective would be to help our providers to be more familiar with applying the Medicare secondary payer insurance type codes when submitting electronic claims. So at the end of the session, you'll know exactly what's needed in the electronic format when Medicare is the secondary payer. So we'd like to first go over the first steps, the provisions. We'll talk about the insurance type codes, the electronic loops and fields or loops and segments. Field in the language segment means the same to your vendor, your clearinghouse, or your representative, and our portal, which is NGSConnex. It'll be important to review that as well. So let's first talk about the first steps. It is a provider's responsibility to determine whether Medicare is a primary or secondary payer for services rendered. So that is making sure that you're obtaining primary insurance information from your patients, right? You always want to bill payers first, make Medicare last, submit all claims to Medicare as a secondary, even when the primary payer has paid in full. There are other obligations such as deductibles, and those claims should always be submitted to Medicare as a secondary payer. It will be important for our providers to know the 3 C's: to collect, to copy, to check insurance data, and also documentation is key, right? So you want to collect all of the insurance information from your beneficiary. Then there's a verification process, and it's the admissions question that come from the regulations. It falls within section 20.2.1. It's in the Medicare Secondary Payer Manual, Chapter 3. Ensure that you're following the model questionnaire. You want to make sure that you're getting, and you know everything there is to know about your patients. And then next would be to check eligibility records. And you're going to do that via our portal, NGSConnex. Have to be a registered user, but it's quite simple. And it allows our providers to get the information you need when you need it. With that said, time limit is of importance, right? So the time limit for MSP is the same for non-MSP. You have 1 year from the date of service. Claims shall be submitted, and if they're not within that 1 year timely filing, then it becomes provider liable, and beneficiaries cannot be charged. So there are certain exceptions to the timely filing, but do note, none of the exceptions are because a provider failed to get the primary insurance information and document everything. The exceptions fall under administrative error through Social Security, Medicare, Medicaid, or retroactive entitlement within the Medicare Advantage plans. So all that is in section 70.7. It falls in chapter 1, and once again, in the Medicare Secondary Payer Medicare Claims Processing Manual. Provisions are key. So there will be provisions in each category. So let's talk about your group health plans, non-group health plans, and government plans. First, we'll talk about the group health plans. This is when people are working and have insurance coverage through their employer. Now, if you're over the age of 65, 65 and older, it puts you in the working age category, insurance type code 12. If you're under the age of 65, it puts you in the disability category, right? So disability, insurance type code 43. And then if you're on Medicare due to kidney failure, which is end-stage renal disease, then that will put you in that category. The insurance type is 13. The important thing to remember with group health plans, they're either always primary and Medicare is always secondary, right? So once you have, or if you have, or your patients have group health plans, then yes, once again, that plan becomes the primary payer. With the non-group health plans, that pertains to situations of injuries that have been either sustained in a workplace and covered under workers' compensation, insurance type code 15. There could be an automobile accident or no fault. Insurance is liable for those. Insurance type 14, and then liability incidents or accident, public or private. Insurance type code is 47. Do know with the non-group health plans that Medicare is not primary. There's other insurance primary for the injuries sustained. An individual could have Medicare for non-workers' comp, non-auto, no fault, not a liability situation. So it works a little differently than the group health plans. And then government agencies, they're not really considered Medicare secondary payer because the federal Black Lung program is a benefit for those suffering from pneumoconiosis, suffered from coal mining. So there's a Department of Labor is going to process those claims. They will not come to Medicare and Veterans Administration. So if a beneficiary is treated at a VA facility, the VA facility takes care of those services, right? We'll move right along and we'll talk about the insurance type codes. We talked about it a little bit earlier, but now let's talk about it a little bit more in depth. Working age puts a beneficiary 65 or older. And it makes Medicare secondary when the individual is either working or their spouse, and there is coverage by the employment, and that employer has more than 20 employees. So Medicare is a secondary payer. Then insurance type code 43, disability would be for those beneficiaries under the age of 65. Disabled, could be working part-time but have insurance benefits, or could have insurance benefits through a family member. So the large group health plan comes into play when the number of employees are 100 or more. And then 13 would be for the end-stage renal disease. Beneficiaries who take Medicare but have current enrollment through their group health plan through their employer. So once again, if there's an individual that is working, has group health plan through their employer, and then goes on Medicare, that employer plan remains the primary payer for 30 consecutive months. Medicare would be the secondary payer. Then when you get to the non-group health plan, and usually you're submitting claims to these payers, and they're not coming to Medicare as secondary, generally speaking, because auto, no fault, those claims should be paid. Workers' compensation claims will be paid by workers' comp. Liability by the liability insurance. But let's say these insurers are not paying claims. We don't expect our providers to wait. You have up to 120 days, which is the prompt period, to submit your claims to the other payer. And if they're not paying, you may submit these claims to National Government Services on a conditional basis. And there will be appropriate loops and segments or loops and fields to be populated. But the insurance type codes you have right here. Auto no fault 14, workers comp 15, and liability would be 47. Moving right along to the appropriate loops and the fields. So really important that you share this information with your vendor, your clearinghouse, or representative. and identify within your practice all of your patients that have Medicare secondary. Because when these claims are submitted to National Government Services, there will be certain loops and fields that need to be populated. Indication that Medicare is secondary. The insurance type code that we've been talking about is needed. The coordination of benefits payer at the paid amount, primary payer allowed amount, any type of adjustments obligated to write off in full at the claim line level, and then claim adjudication date, adjudication information, any line adjustments, and line adjustment dates. So share this document. It's out on our website, NGSMedicare.com. Go to Claims and Appeals under Medicare Secondary Payer. Scroll down to the bottom of the page, and you're going to see the Medicare Secondary Payer Manual for electronic submitters, ANSI specifications for the 837 professional claims. Once again, share this with your vendor, your clearinghouse, and your representative. So today's session is about the insurance type codes, right? Identify the reason for the coverage so that when you're submitting Medicare secondary payer claims and you have 2000B loop and 2320 loops populated, then the fields or the segments that correlate will also have to be completed. And that would be 2000B SBR01 and 2320 loop SBR05. So when 2000B SBR is 01 equals an S for secondary payer, we're going to now look for the loop 2320 SBR05 value of the insurance type code. And out on our website, we have another handy reference for you that talks about populating Medicare insurance type codes. All of this information is on NGSMedicare.com, right at your fingertips. So now let's talk about NGSConnex beneficiary eligibility, because you'll need to go to the eligibility files after you've collected, you've copied, you've asked the questions. You need to check NGSConnex. NGSConnex is our provider portal here at National Government Services. You want to ask yourself, is Medicare the secondary payer? You come down to your validity indicator, and if it shows yes, positive, why Medicare is secondary, here's your type code that you'll need for your electronic claim. If you move over to the left, there will be an effective date or a termination date. This has no termination date. This example shows you that Medicare is the secondary payer for this individual. If there is a termination date, Medicare would be secondary payer between these two dates. Once again, you have out on our website, NGSMedicare.com, under Claims and Appeals, Medicare Secondary Payer. Scroll down to the bottom and you'll see the ANSI specifications for the 837. You may also put ANSI specifications for 837P, MSP in the search, and it will automatically bring this document up to you. We also have our portal, which are navigation steps. If you need help navigating to the eligibility for Medicare secondary payer, you may access our navigation guide for NGSConnex. Final review, folks. Screen your patient's eligibility in the NGSConnex portal. Use the Medicare secondary payer ANSI specifications. You want to enter the MSP insurance type code on all Medicare secondary payer electronic media claims, so that when loop 2000B segment SBR01 equals an S, then loop 2320 in segment SBR05 will need the appropriate insurance type code. Increase your revenue, decrease that administrative burden to have to keep submitting claims over and over again. And here at National Government Services, we have an awful lot of reference material. It falls under the Claims and Appeals, Medicare Secondary Payer. Be sure to visit us and subscribe to receive all of our email updates. With that said, and National Government Services is here for your on-demand education right at your fingertips, YouTube channel, as well as Medicare University. We have our website we've been talking about, and it has a great deal of information for our provider practices. You have online resources. We've created tools, decision trees, job aids. We also have manuals, guides, and policies that fall under local coverage determination and national coverage determination. Now, we have our interactive voice response system, but do note you cannot obtain eligibility facts within the interactive voice response system. Therefore, you'll need to register and become a user of our portal. If you fall within any of our 10 states, you may register for NGSConnex, our provider portal, giving you access to beneficiary eligibility, claim facts, financial, initiate clerical error reopening, initiate your first level of an appeal, which is a redetermination. So with that said, I want to close with sign up for our email updates. If you've not done so, make today the day that you will do that. With that said, we want to thank you all for listening to National Government Services YouTube video, and please be on the lookout for future sessions. We will be here to help you. Thank you and have a wonderful day.